Why your leg injury not healing? Arthrogenic Muscle Inhibition, AMI, and its impact on rehabilitation. Following an injury or a period of immobilization, muscle strength and neuromuscular coordination are rapidly compromised. Before initiating isotonic or dynamic strengthening exercises, it is essential to restore adequate neuromuscular control and achieve effective voluntary isometric activation of the affected musculature. This ensures appropriate motor unit recruitment and joint stability prior to progressing to higher functional loads. The inability to generate strong isotonic contractions after joint injury is frequently associated with arthrogenic muscle inhibition, AMI. AMI represents a reflexive neural inhibition of periarticular muscles, commonly provoked by joint swelling, capsular distension, or articular receptor damage. These alterations in afferent input reduce the excitability of alpha motor neurons in the spinal cord, thereby limiting the number of motor units available for voluntary contraction. The result is diminished force production despite intact muscle tissue. Consequences of unresolved inhibition. Advancing exercise intensity or complexity while a muscle remains inhibited may lead to the adoption of compensatory recruitment patterns, disrupting normal kinematics and joint function. Prolonged inhibition can contribute to chronic muscle weakness, altered proprioception, pain, and atrophy, ultimately delaying the rehabilitation timeline and impairing return to activity. Clinical implications. Early identification and management of AMI are fundamental in musculoskeletal rehabilitation. Effective interventions include neuromuscular re-education to retrain motor unit recruitment, proprioceptive and balance training to restore joint feedback, cryotherapy or effusion control to reduce inhibitory joint afferents, joint mobilization techniques to normalize capsular tension, electrical stimulation, NMES, to facilitate muscle activation. An integrative approach targeting both peripheral, joint-related, and central, neural, factors of inhibition promotes efficient restoration of voluntary control and optimal functional recovery. So remember, if your joint is swollen, it's not just the joint, your muscles are affected too. Treat both together for faster recovery.